From Chicago's Can TV, a look at the week's events is reported in the newspapers, in the blogs and online, and on radio and TV. This is Chicago Newsroom.
Well, hi there. Welcome to Chicago Newsroom here on Can TV. I am Ken Davis, and this is where we sit and talk about the issues that concern us, mostly about Chicago, but we got a lot of other things going on this week that we'll be talking about. But let's begin today with a few fun facts about Cook County, shall we? You know, there are 135 cities, towns, and villages in our county. Chicago is only one of them, although we Chicagoans do make up 54% of Cook County's population. There's one other county in the whole country with more population, and that's LA County. And 40% of all the people who live in Illinois, live here in Cook County. In fact, our humble little county has more population than 29 of the 50 states. So why are we talking about this? Well, Cook County is a massive provider of health services, a massive confiner of prisoners. We have one of the biggest public hospital systems in the country and the nation's biggest single-site jail. It costs a lot of money to run Cook County, but most Chicagoans don't really pay that much attention to it. We do know Toni Preckwinkle, though. She's the president of the Cook County Board and a very prominent political leader around these parts, and she's been making a lot of news lately talking about what might happen to our county healthcare system if the Republicans succeed in repealing Obamacare. In fact, the Trump administration could make things a lot more difficult for Cook County, and Toni Preckwinkle, we're happy to have you here today to talk about these and other things. We have a lot of things to talk about with respect to county care and the number of people who've received help through Medicaid and all that kind of thing. But before we do that, I just want to say, do you mind if we just get right off onto something else before we even get started?
Sure, go ahead.
What do you make of this thing of the Sun-Times being subsumed into the Tribune? At least that's not what they're saying. They're saying it's something other than that. But I mean, the Sun-Times may no longer exist.
So I'm a history teacher, and I was taught that newspapers are the first draft of history. I subscribe to the Sun-Times and the Tribune. I guess that makes me an odd duck these days.
Right.
You know, I don't think this is a good thing. It's hard for me to believe that, in fact, the Sun-Times will continue to be an independent operation. And it's very troubling to me that we have the loss of a newspaper, in effect. You know, lots of media markets in the country now only have a single newspaper voice. I don't think that's a good thing. I think democracy is much healthier when people can go to a variety of sources for their news. And the fact that, in essence, this will be one source now, I don't think it's a good thing.
Yeah, I've said often on the show that in this day and age when fewer and fewer people are reading the printed edition, the value in a newspaper isn't so much what it prints, it's newsroom. The newsroom is the beating heart of the organization, and the Sun-Times, for all of the assaults that it's had on it in the last few years, still has a thriving newsroom. And I can't imagine that the bosses over at Trunk are going to say, well, we want to put more money into making it an even better newsroom. It just doesn't seem possible to me.
Well, if your focus only is on the bottom line and not on the quality of the product you're delivering, it's hard to believe that that is going to be the case, that you'll invest in, more reporters, better coverage, whatever.
Yeah. I understand that we sound like old people sitting here talking about our valuing, our valuing of newspapers and all that. And often when people come here and sit down at the table, they see our little table clutter here and they say, wow, I haven't seen a copy of the Tribune in 6 months. I didn't even know, it's not.
It's a generational thing.
It is. But the fact of the matter is that both of these news organizations are still kind of setting the agenda. Even though fewer people are reading them in print, they're still reading them online. They're doing well online. And they have a role to play in the civic space, in the civic debate. And I'm really sorry to see one of them as threatened as it is.
So, again, I'm a history teacher, and I used to begin my American history classes by saying, democracy is at the same time the best and most fragile form of government on earth. It depends on an active, engaged, informed citizenry. Right. And to the extent that We lose access to information, to sort of differing points of view. I think, democracy suffers. I don't think it's been good for our country that, we have fewer cities, fewer regions in which there are competitive newspapers.
And the other thing, of course, is we've had such a conversation since the beginning of the Trump administration about fake news and the way news is disseminated to us largely through Twitter and social media and so forth. And what these guys offer us, what they offer our society is editors and fact checkers and people who really do strive to try to make the news they present as accurate as possible. It's an old-fashioned notion, but it's important.
Right. Well, on social media, it's very difficult to determine the veracity of what you're reading,
Right. Well, anyway, I just wanted to see how you felt about it because I think there's a kind of a general shrug going on, like, so what? Nobody reads it sometimes anymore anyway. But I don't think people quite understand the effect that those newsrooms are still having on our political life and our civic life in Chicago.
Right. No, I agree.
All right. Well, let's get to the thing that we asked you to come here to talk about, which is
we can do
county
that.
care and the ACA. I've heard you speak very convincingly over the last couple of months about the impact that Obamacare, the ACA, had on Cook County, and it is profound and it is good.
I'm very grateful to President Obama for making, healthcare part of his public legacy. Almost 500,000 people, 480,000 people in Cook County got healthcare coverage through the Affordable Care Act. 500,000 people, and across the country is 20 million people. So that that's not an insignificant number. And in our own health system, before the ACA, about 70% of our patients were uninsured. And
we're talking about the county hospitals.
County health and hospital system, yeah. And now the reverse is true. About 2/3 of our patients are insured and 1/3 are uninsured. So what we've seen is not only lots more people getting health care coverage and the security that brings, but also public health institutions like ours, and not just us, all the hospitals and, whether they're academic or safety net, and a lot of our neighborhood-based health clinics have also seen, real benefits to their bottom line as a result of the fact that more of their patients have insurance. I was talking yesterday to a member of the board of the University of Chicago Hospitals who was decrying the changes that might be coming from Washington and what impact that would have on the University of Chicago hospital system. So it's not just our public health institutions, it's our academic, our safety net hospitals that will be impacted, as well as our neighborhood clinics.
I think it's just so important to point out that, Mark Brown actually did a very good column on this a couple of days ago in the Sun-Times, talking about 54,000 adults that would be at risk of losing their coverage. And it's not...
It's more than that. In Cook County alone...
just from county, you have 140,000 people in
right,
county
140,000.
54,000 of those could possibly lose. But I just want to make another observation here. It's not just that the hospital system has benefited and that a lot of people got coverage. What we're talking about is a lot of people who, for the first time in their lives, actually had insurance and were able to get preventive care, the kind of thing that we always talk about that everybody needs to have. It was the beginning of something that could have revolutionized the health of people in our county.
Right. What's happened historically is that people who don't have health care coverage don't get primary care. They wait until they're really sick and then they go to the emergency room, which is a very expensive way to deliver care to people. You're much better off if people have a primary care physician, a medical home, and they get their meds regularly, they get frequent checkups, so any chronic conditions they have, whether it's hypertension or diabetes or whatever, are addressed on an ongoing basis rather than waiting until they have a stroke or some horrible complication of their diabetes, and then they end up in our emergency room. So it's a much more efficient way to deliver care, to put the emphasis on primary care and medical homes, than it is to leave people without coverage and then they seek coverage only when they're desperately ill and then through our emergency room.
Right. I mean, there's there's the effect on the individuals, and there's also the effect on the institution. You've said that for the first time, really in its history, the Cook County hospital system is essentially financially stable.
Right. For the last 3 years, the hospital system has been in the black.
That's amazing.
It's unprecedented. And what you have to understand is in 2010, when I was elected, the taxpayers of Cook County were contributing $400 million a year to our healthcare system. And in this last budget, it's like 111 and a half or something like that. So there's a $300 million difference. Some of it's efficiencies over the last 6 years, but most of it is the substitution of federal dollars for local dollars. The federal government took on the obligation of trying to provide health care for the uninsured across the country in those states that were willing to become part of Medicaid expansion. And that has been a godsend for the individuals who got the care, who got health care coverage, and a godsend for public institutions like ours, as well as our hospitals and clinics across the county, whether they're public or not.
And it's pretty profound when you think that they now can spend their time thinking about how to provide medical care and improve medical care for the indigent and the poor people in our communities. Whereas only a few years ago, the debate was always centered around how can we close these places? I mean, that always seemed to be, it's like, well, can we close them in 2 years or 5 years? Which of the hospitals should we close first? I mean, that's for as long as I've been alive, that's been the conversation.
Yeah. You know, I think Dr. Raju, who was head of the healthcare system early on when I got this job, used to say, you know, you have to understand whether or not you're a participant in a program like Medicaid expansion. It's in your interest to have everybody have health care coverage, because you want everybody who you ride the bus with or the train with in the morning, you want everybody who serves you in a restaurant to have good health care coverage. You don't want them to be sick, you know? You know, disease doesn't have geographic boundaries, especially contagious diseases, or class boundaries. And so you want to be sure that what it's called herd health, I think. You want to be sure that the herd is as healthy as possible, because that ensures the health of the individuals.
Yeah. So is the Cook County hospital system in the really weird position now of being placed in the competitive marketplace? I mean, interestingly, if somebody has health insurance through Obamacare, they don't have to go to Cook County Hospital anymore. They could go to some other hospital, right?
Yes. So this is kind of uncharted territory for us, because in the past, nobody wanted our patients. They were poor people with complicated illnesses, often you know, multiple issues that were challenging them. You know, diabetes and hypertension at the same time, or struggles with cancer. And we were a provider of last resort, and we took anybody who came to our door. We still do, regardless of their income, their insurance status, their citizenship status. We take anybody who comes in our door. And that's been a blessing for Cook County for 180 years. But as a result of the Affordable Care Act and the fact that people have insurance, now they can choose. And so we're in an environment which is competitive for the first time for us. And the real challenge for us is to up the quality of care that we deliver and people's perceptions of us. You know, I think if you ask people, they know that our emergency room is a world-class institution. If you have trauma, if you're shot, if you're in an automobile accident, burned, that's the place you want to go. But we have a world-class institution across a number of specialties, and what we've got to get out to people is not just our emergency room that's wonderful, it's more broadly the care we deliver. And we've got to be sure that we in fact deliver high-quality care. So the fact that we're in a competitive environment is a good thing, because it's the result of the Affordable Care Act, but it's also a challenge for us, because that means that we have to both market ourselves and deliver services in a way that we haven't been forced to do before.
And all of this has happened, I'm not blaming it on you, it's all happened since you became president of the county. I mean, in this
good fortune.
This incredibly short period of time in this 180-year history, everything has just kind of turned on its head.
Yes, there's the old Chinese curse, may you live in interesting times.
Well, I mean, it is almost entirely good news, but then of course we have this idea that if ACA goes away or is severely modified, there's almost no doubt that the people that they'll chop first will be the very people who have been your patients all this time. So then that contribution of that, whatever it was, $300 million that you're no longer making to the hospital, you have to make again.
Right. Well, and it's worse than that, because we believe that it's not just that we'll lose the federal support for the people that are in our own Medicaid expansion plan, which is called county care, that 145,000 people, but that people who were in other Medicaid expansion programs, and ours isn't the only one, Blue Cross Blue Shield has one, for example, some of the private insurance have them, people who were covered by those programs as well will come to us by default, as people without insurance in the past have always come to our public health system. So we estimate the impact is at the minimum $300 million, but it could be as much as $800 million. And we only have a budget of $4.2 billion, so that's a pretty big hit. And, you know, this sounds horrible, I know, but as difficult as things are in Washington around Trump's decision to fire Comey, the ongoing investigation of Russian influence and possible Russian influence, I should say, in our election last year, our presidential election, all the things that are happening, it seems to have moved attention away from from substantive issues like healthcare. And
you're no longer that one that's head's sticking up that's going to get clubbed.
Pounded, yeah.
There's somebody else. There's other heads sticking up at the moment. Yeah.
So, you know, the bill that came out of the House was terrible and would have a devastating financial impact on our system and, of course, on coverage for previously uninsured Americans who got coverage under the Affordable Care Act. So it's a nightmare. Our lobbyists in Washington has suggested that the Senate would if it gets to this in the midst of the present turmoil in Washington, would probably have a quite different bill that emerged from the Senate. And then there's a question of whether the House and the Senate could agree on some reconciliation of the two bills. But you know, I'm really afraid because I don't see where we're going to get $300 to $800 million to support our healthcare system. And this has always been a touchstone of the county, that we provided healthcare coverage to people who desperately need it and didn't have the resources themselves.
So let me ask you this: what happened to the $300 million that you saved? I mean, don't you still have that money just sitting in a box somewhere that you could just?
Oh boy, do I wish! All right, well, you know, we've made a lot of changes in the last 6 or 7 years. We've reduced our workforce, and you know, I'd be the first to admit that the county, previous to my tenure, was a patronage haven, and you're astonished, I know. We've reduced our workforce 10%.
I hadn't heard that before.
We've reduced our indebtedness 11%. We've been working hard. To try to manage government more responsibly. We have balanced budgets. I know that's sort of not the pattern and practice, at least at the state level, for the last couple of years.
Oh, pattern and practice! I've heard that somewhere before. Yeah.
And at the federal level as well. So I mean, we've tried to be very responsible, and it's a challenge when you've met your obligations for the last 6 or 7 years and done what you believe is the right thing, to be in an environment where so much is out of your control and will have a devastating impact on you. So we've talked about the federal level ACA. The other things that they're talking about, tax reform, for example, and a budget that would slash expenditures for things like Medicare and Medicaid. Even if there isn't health care reform, they would propose to reduce those. Reductions in what Nixon called revenue sharing is now community development block grants. They're proposing to dramatically reduce that program, and those resources allow us to support affordable housing, facilities for not-for-profit organizations, direct subsidies to not-for-profits for the services they deliver. So it's not just the Affordable Care Act, but the changes that they propose in the budget and things like tax reform that would reduce the attractiveness of low-income housing tax credits to corporations, because that's part of the layered financing on a lot of our affordable housing deals, low-income housing tax credits. So there are a lot of things that are being contemplated or talked about in Washington that would be devastating for us. And while we can sort of track it, our ability to to influence it is pretty modest.
So I think what I heard you say is that ACA comes on the scene and starts picking up the tab for about, let's just say round numbers, $300 million that you no longer have to pay. But at the same time, they're doing all kinds of other things with block grants and everything else that you have to put money into things that you weren't putting it into before. So the whole thing sort of washes in the end.
Well, yeah, I mean, what's happened is we have not had to raise revenue to the extent that we might have had to otherwise to support our ongoing operations. And we have two legacy obligations, public health and public safety, which are 87% of our budget. I mean, everything else the county does is 13% of the budget. So
that is amazing.
46% of our budget is public health, 41% is public safety. And so we've been able to continue those operations and actually to run them, I believe, more effectively and not have had to have tremendous revenue increases of the kind you saw at the city, for example, in part because of the resources that have come into us through the Affordable Care Act. We still have challenges, needless to say, but we're in much better fiscal shape than either the city or the state. Given, I mein, that's a low bar, I guess.
I was just going to say, well, good for the county, yeah. In pure brass knuckles politics, if by some chance Trump goes down and Pence becomes president, would you be more fearful of a Pence presidency than a Trump presidency?
Well, it's hard to know exactly what Donald Trump's politics are because he's kind of been all over the map.
But you know what Pence is on.
Yes, he is a profoundly conservative and in some ways more challenging person to occupy the White House than Donald Trump. Doesn't seem to have any ideology or consistent political viewpoint. That is the President Trump. So in lots of ways, yes, a Pence presidency would be more problematic for us. And there surely wouldn't be this sort of three-ring circus in Washington that presently.
That's been my observation of this is that Trump, for all of the almost entertaining kind of sideshows that he's putting on, there's no central ideology there, and it kind of depends on who he's spoken to last. So it's hard to paint him as specifically an enemy of one group or another. But Pence, he's got a track record, and he's single-minded about these things, and appears to have pretty good political skills. So he might be able to keep the House in line and even the Senate in line. And I just wonder if things won't get significantly worse for governments like yours if Pence becomes president.
Yes, I think that's a definite possibility. The devil and deep blue sea are the choices here. So.
Yeah. Could we talk a little bit about our other political leader, Bruce Rauner? When we spoke earlier, he had put a kind of I don't know what you'd call it, but a sort of a sample budget on the table, which was going to cut 40 different areas by $242 million, including higher ed, mass transit, after-school programs and all of that. How does or would the Rauner proposed budget affect Cook County?
Well, let's go back a little bit before we talk about the budget that's proposed to the fact that we haven't had a budget for 2 years.
Oh, since you mentioned it, yes, forgot that.
So my understanding is we're the only state in the country that's gone for 2 years without a budget since the Great Depression, which by my calculation is 70 years ago, 80 years ago. So, that's profoundly disturbing right there. The first obligation of government, at whatever level you are, is to, if you're the executive, propose the budget and then get it passed. And the fact that, when Rauner came in, he said, I'm only going to work with them on the budget if they do X, Y, Z.
Right.
Term limits and workman's comp and whatever else he was talking about. Well, when I came in, there were things I wanted to do too, around affordable housing, around consolidation in government, around immigration. But I never said to the Board of Commissioners, I will only work with you on the budget if you work with me on the other things. Government operations is one thing, and then your substantive agenda on these other issues is another. And your first obligation is to get your budget passed. So we've passed balanced budgets for the last 7 years.
That just sounds so remarkably elemental somehow. that as chief executive, you believe your first job is to pass a budget.
Yeah, how about that?
That's kind of old-fashioned, isn't it?
Only in Illinois. All right, so, it's hard for me to attribute his unwillingness to understand that that's his basic obligation to anything other than a profound misunderstanding of how government works. And he never held government office before he became governor. I think that's a very bad thing. Now, I say that as somebody who spent almost 20 years of my life being an alderman, which is sort of bottom of the totem pole in terms of elective offices. But I think he thought that government was like the business that he ran. And what I usually say about him is he thought that, as was the case when he was chief executive, or one of the principles of his corporation, that he could just give orders and people would salute and click their heels and run off and do whatever he told them. But that's not the way government works. You have
Nor
to.
should it be.
You have to deal with people who got elected on their own, who have their own ideas, their own vision, their own constituencies. You've got to persuade people, make deals with people. You have to build a consensus for what needs to be done and then move ahead with it. You can't just give people orders. You can't say, I want you to, change workman's comp laws. I want you to enact term limits. I want you to do whatever else it is, and think that they're just going to do it. They won't. And I don't know, particularly given the strong leadership in the President Cullerton and Speaker Madigan, how he felt that he was going to just tell them what to do and they would do it. And then I think he got himself boxed. I mean, when he finally figured out that wasn't going to work, he'd already said that these were the conditions on which he would work with him on the budget. And I don't think that the House and the Senate, and particularly recently the Senate apparently has passed some measures, some compromise measures. We'll see what their fate is in the House. But I don't think that either the House or the Senate were averse to some willingness to work with him on these other issues. But to tie it directly to the budget, I think, was a terrible mistake on his part. And it's had disastrous consequences for the state. First of all, our social service safety net. If you think about it, last year at this time, Lutheran Social Services, which is along with Catholic Charities, one of the biggest providers of social service in the state, laid off more than 700 people. And Catholic Charities has likewise shrunk. And these are our biggest social service agencies. Lots of small ones have just gone out of business because the state either is not paying them or is paying them 9 to 12 months after the services have been delivered. They can't carry the state that long. And so we've seen lots of social service agencies close their doors. I mean, my favorite story about him is that, he decides he's going to end funding for autism on National Autism Day. I mean, he just has, apparently, there's no connection between his politics and the larger world. So I'm not surprised that we're in this mess, but I think that you have to understand that, and I should go on, it's not just the social service agencies.
How about education?
Well,
How about higher
let's talk about
education?
local units of government, then I'll get to higher
Yeah.
education. So first, social service agencies, near and dear to my heart. Then local units of government. The state owes us, as of this month, $107 million. $107 million. Mm-hmm. And they've owed us as much on a monthly basis as $183 million. Mm-hmm. The range has been $57 million to $183 million.
And we're seeing the same thing with the city of Chicago, right? I mean, they're in for like $400 million or something.
Yeah, it's terrible. I mean, but all of our local units of government are impacted by the fact that we don't have a state budget. I think people don't understand that. And in our county, we've been able to manage it, but for units that don't have reserves, mm-hmm. they're either borrowing money or cutting services, mm-hmm. or laying people off. I mean, this is a nightmare. And then higher education. I think the funding for higher education ended by whatever deal they had last December. And so institutions that have been on fairly shaky ground, like Chicago State University, are on the precipice now. And also, we have to understand this not just in the city of Chicago and Cook County, but Southern Illinois University in Edwardsville, mm-hmm. and Southern Illinois University in Carbondale, and Northern mm-hmm. Illinois in DeKalb. These places are not just educational institutions, they're economic anchors for their little sub-region of the state. And the idea that we're suddenly going to stop funding them, or apparently mm-hmm. his view is we have too many of them, we should reduce the number, this is a nightmare for mm-hmm. not only opportunity for young people, and education is, in my view, as a teacher, of course, is the key to advancement for yourself and your family and your community. not only are we denying people educational opportunities and making it much more difficult for them to secure higher education, but we're having a devastating impact on the economic vibrancy of the communities in which these anchors are located. And then, of course, the national perception of us. So social service agencies are being devastated. Local units of government are really challenged because the state's not paying or paying 9 to 10 months late. Our higher education institutions are really struggling. And then we're the only state in the country that hasn't had a budget for 2 years. It makes us look like we're hopelessly inept and dysfunctional. It's hard to argue that we're not.
And these things also cycle back around on themselves, because the national perception is that Illinois is falling apart. So if you were a kind of a smart, 20-year-old, and you were thinking maybe you'd come to Illinois or come to Chicago or the Chicago region, maybe create a career here, you're going to take other options, because you're seeing, it doesn't look like the University of Illinois is even going to survive this, so I think I'm going to go someplace else. And that's eating the seed corn.
Right. What we're seeing at some of our institutions of public education is that fewer kids are applying. So that's a downward spiral too, right?
Right. Yet another downward spiral.
So fewer kids apply, fewer talented young people choose to come to Chicago or to Illinois. And Chicago is a beautiful city and a very attractive place, but given the larger environment, it's a challenge.
Yeah. Our guest today is Toni Preckwinkle. She is the president of the Cook County Board, and you're watching Chicago Newsroom, and maybe you're listening to us on SoundCloud or on our iTunes feed. And if you are, that's what you're listening to. Since we're, sort of elbow deep in politics here, you as what is your title? You're the chairman of the Democratic Cook County Democrats, or is that what you are?
Joe Berrios is the chairman.
Oh, that's right. He's the
I'm a vice president.
But you were certainly present at the at that sort of whatever it was, slating or non-slating session where all the Democrats showed up to offer themselves up, and it looked like there was a pretty robust conversation going on there, but now it's all changed. It's like all of a sudden Pritzker has just kind of been anointed. There's really no reason to have a primary anymore, is there? All the big guys are saying it's Pritzker.
I don't think that's true. Chairman Berrios and I talked about this, and the idea was early on to give all the committeemen a chance to meet and hear from the diverse group of people who said they were interested in running for governor. And that includes Diber, who I think is a education superintendent in the Collinsville area, East St. Louis. And then Prawar, who's an alderman here in Chicago. At that time, Kurt Summers, treasurer of the city of Chicago, was exploring the possibility. Dan Biss, State Senator Dan Biss. And then, of course, the two candidates who have the most resources to put into the campaign, Chris Kennedy and J.B. Pritzker. And I think that there'll be another session with all of the candidates in June, I think the third week in June, and then slating in August. I think this is still pretty much an open.
The sort of common wisdom seems to be you got to have a billionaire to take on a billionaire, which of course in itself is another whole conversation about how corroded our politics are, that we've just sort of reached the point now where only billionaires can play. But I don't know. It seems to me that you have some kind of independent voices in Prawar and Biss, but that they're just not able to be heard anymore.
Well, I think both of them hope that they will be able to tap into the enthusiasm and grassroots energy that Bernie Sanders exhibited, and I'm not sure, how that will go. And surely Chris Kennedy and J.B. Pritzker have personal resources and family and professional networks that they can draw on to raise a lot of money. But we're talking in a week in which Ken Griffin gave Bruce Rauner $20 million. The wealthiest man,
point that out.
wealthiest man in the state gave our governor $20 million for his race. So it's hard not to argue that at the highest levels in politics in this country, you need considerable personal resources to be a viable candidate.
Do you think, as an experienced politician, that Bruce Rauner is vulnerable?
I hope and pray.
That wasn't really my question, though. Do you, I mean, intellectually, do you believe that he's all that vulnerable? Because he doesn't seem that way to me.
No, I think he is. I
Yeah.
think we have to get the word out about the devastating impact of his failed leadership on ordinary people in Illinois. And I think the poll numbers for him are, below 50%. Think he's doing a good job. So that's, if you're an incumbent and theoretically you've been working hard for your constituents for the past 3 years, it's hard to argue that that's a good thing.
I think we can lose track going back to the introduction of the show, where our county is bigger than most of the state, and so we tend to think that our views are the views of the state, but they're not necessarily. I mean, you get outside of Cook County and he seems to be pretty popular.
Well, the truth is I'm not in touch with a lot of people outside of Cook County at that level, so it's not something I can. I know that Donald Trump did well in the state of Illinois, below I-80. And that's disturbing to me, given what I think of him.
It would be interesting to consider what would happen if he got reelected. It would be, I think the politics would change quite a bit if
Rauner was
if
reelected.
Rauner got reelected. Yeah.
I think his governorship has been devastating for the state of Illinois. So, needless to say, I'll be working hard to ensure that he's not reelected.
Do you ever have any contact with him? Do you talk to him regularly, or does he pick
I
up
went
the
to
phone
see
to
him.
call you to ask you how you're doing?
Of course not. I periodically ask to talk to him about things. I'm sorry, that's not quite true. Last fall, we talked. He asked for some help on getting support for the waiver, an Affordable Care Act waiver for the state of Illinois for some things that the state wanted to do. And needless to say, wasn't having much luck getting our Democratic delegation to support him. So I said I would go to Washington. Dr. Shannon and I went to Washington and talked to, among others, Senator Durbin and Congresswoman Jan Schakowsky, who'd taken a leadership role on helping Cook County with its health care issues in Washington. And both of them sent letters subsequently supporting the state's waiver to the Department of Health and Human Services that was taking it under advisement. But when I went back to him later, December or January, and talked to him about what a devastating effect the state budget had, the failure to have a state budget had on local units of government like Cook County, I'll just say it was unsympathetic. And he basically told me, I showed him the spreadsheet, I just said, the least you owed us is 57 million, 56.6. The most you owed us is 183. This is a nightmare for me. How am I supposed to manage the government when you don't pay your bills? And his response to me was, Speaker Madigan, Mike Madigan would love this. I said, this isn't about what Mike Madigan would love. I'm telling you the impact this is having on Cook County. I'm going to take this same spreadsheet and show it to President Cullerton and Speaker Madigan. This is not, I'm not showing this to you because Mike Madigan told me to, or because I think this is something Mike Madigan wants me to do. I'm showing you this because it's devastating on its impact on Cook County. And I haven't talked to them about it. I'm going to go see them subsequently.
It really is different, right? It's different than it's been before. I mean, with other governors, it is profoundly different.
The only other governor I've worked with is Pat Quinn. So I can only compare Pat Quinn and Bruce Rauner.
Yeah. And you would compare Pat Quinn favorably, I assume?
Yeah. I mean, he understood that it was his obligation to get a budget passed.
Right.
He clearly had his struggles in Springfield with other Democrats, but he understood that basic fact, and that appears to be a challenge for the incumbent.
So, can we just turn briefly to other sort of politics that are the politics of crime? We are almost to the day 6 months from when the Department of Justice, remember the Department of Justice, issued its rather scathing report on the Chicago Police Department and patterns and practices in the Chicago Police Department. I was just reminded yesterday, looking over some clips, that you spoke publicly about that and talked about pervasive racism in the Chicago Police Department. That was back in January. There was a lot of optimism that the DOJ report and the police's own internal report would spur some serious change in the Chicago Police Department. So far, I think it's objective and fair to say we haven't seen any of those or many of those changes. And the politics have changed too, because the representation of the Chicago Police and the FOP has, the head of that has changed. What's your level of optimism at this point?
I think it's a real challenge. I think external pressure to perform better would have been helpful to the Chicago Police Department. It's clearly absent now. Attorney General Sessions has basically said, "Whoa, we're not going to look at local units of government and how they police their communities. We're not going to engage in these kind of audits of performance that we engaged in before." That's
Let the police do their job, I think was the phrase, right?
Yeah. Well, we know what that has meant. You know, I think the police department faces a number of challenges. I mean, if you look at the report, the fact that people didn't get training after the academy. I mean, what kind of a profession doesn't demand ongoing, continuing education? You know, and we have done our police officers a great disservice by not providing them with the opportunity to upgrade their skills all through their career in the police department. And, you know, we don't have enough police on the streets. And it's not just police officers on the streets, it's having enough sergeants and lieutenants as well. I had an interesting conversation.
And maybe detectives we could throw in there too.
Well, yeah. I'll get to that in a minute, but you know, one of the commanders said, it's not just that I don't have enough police officers. I don't have enough sergeants to manage my officers on the street well, or enough lieutenants to manage my sergeants. You can't, it's not just that, it's not so simple as we need more officers on the street. We need a command structure that needs to be enriched and supported. So that's a real challenge. You don't provide continuing education. You don't have enough officers, and then there's a culture. You know, I'm sorry. I think we have profound struggles with racism in our police departments, not just here in Chicago, but across the country. This is a national issue. It's one of the ways in which the pervasive racism in our country manifests itself, how black and brown communities get policed. You know, I usually say 80% of the people in our jail come from the city of Chicago, which has half the population of the county. Why is that? It's and 86, 87% of the people in the jail are black and brown. Most of them black, but black and brown. And African Americans and Latinos are together 50% of the population of the county, but 86, 87% of the people in the jail. It's a reflection of how black and brown communities get policed, particularly in the city of Chicago, where most of the people who come into our criminal justice system reside. And you know, black and brown people get arrested for stuff that white people never get arrested for. You know, low-level drug possession. I had a conversation with a judge who came to see me, a person who I'd supported, and she said, you have to understand our kids, and she meant black and brown kids, are getting arrested for stuff like shooting dice on the sidewalk or having a few joints in their pocket. These are things that white kids don't get arrested for, and then you have a criminal record, you've been arrested. And at every juncture in the criminal justice system, black people in particular get differential treatment than is accorded to whites, you know. Black kids standing on the corner, do the police send them home, or do they take them into the station for curfew violations? If they're in the station, do they call their parents and have them come and get them? Or do they put them in the criminal justice system? If they're in the criminal justice system, what are the outcomes for them? You know, the Black Caucus in Springfield did a study of outcomes in our criminal justice system at the statewide level, and found consistently that African Americans had worse outcomes, having roughly the same background as white counterparts, than whites did. I mean, there is a pervasive racism in this country that is profoundly impacts our criminal justice system and results in what we call disproportionate impact on communities of color.
Did you see McDumpke's piece in the Sun-Times about the strategic subject list? We've heard often from the police department that there are a couple of thousand people who are either subject to, who are vulnerable to being shot or might be shooters. And
Yeah,
all
they're the
that
same
kind of
people.
thing. Yeah, but it turns out that the strategic subject list is actually, a couple of 100,000 people, and it includes lots and lots of people, many of whom have never actually been arrested, according to the Sun-Times.
Well, my bitter comment was, what did they do? Just count up the number of black men in the city and decide that they were all strategic subjects? I mean,
Because the majority of people on that list were African American.
right. No, it's one of the most discouraging challenges that we face as a country, that we haven't acknowledged the role that racism plays across a spectrum of issues in this country. And having not acknowledged it, we don't address it.
You're in a kind of an interesting and tough position because, you don't control the police in the city of Chicago, you're the county, but your function is to charge people and imprison them and run the justice piece of it. So it's...
We've put a lot of emphasis since I came into office on looking at the criminal justice system. Again, it's 41% of our budget, and it costs $162, $163 a day to keep somebody in jail. That's a lot of money. It's more than $50,000 a year in a society in which we spend $10,000 a year educating our kids on an annual basis. So we're prepared to spend 5 times as much to keep people in jail as we are to educate our children in the city of Chicago. That's profoundly disturbing to me.
And that leads me to the joint session that happened between the Cook County Board and the Chicago City Council a couple of days ago. Bridget Gaynor, I think, was one of your commissioners, was instrumental in that. And talking about the, as you always say, jobs are the key to everything. But 90,000 youth are out of school and out of work in Cook County. 90,000 young people.
That's 16 to 24. They used to be called disconnected youth, and now they're called opportunity youth. Yeah, 16 to 24-year-olds out of school and out of work. Half of them in the suburbs.
How did that happen?
I'm
sorry to interrupt, but of all the numbers we've thrown out here today, that number bothers me more than anything. 90,000 people. Imagine 90,000 people. That's 2 Wrigley Fields, right? 90,000 people of that age group who are neither in school or at work.
Well, first of all, the federal government has withdrawn significantly from the field of employment training and employment support. When I was elected alderman early in the 1990s, the federal government was contributing substantially to local governments to do, for example, summer employment. All that money is virtually dried up. And the considerable investments that were made in employment programs for youth have decreased as well. So we're not, as a society, paying attention to employment training and assistance for people who are out of work or looking for work in the same way that we did in the past. And that's a terrible loss.
So you're saying we're actually doing worse. The government is actually doing worse today than it was in the past.
In terms of the federal government's support for employment training activity. So one of the things, when Mayor Emanuel was elected, he and I agreed that we would have a task force and look at ways in which we could cooperate, because we share a building, but there have been virtually no collaboration or cooperation. One of the things that our task force came up with was we ought to combine our employment training efforts, because the city had its own employment training, the county, then there was a North and Northwest Cook County employment entity that was pretty much moribund. So we put our federal resources together into a not-for-profit organization called the Chicago Cook Workforce Partnership, or the Partnership, and that does employment training for the whole county. Because people live and work across the county, it didn't make sense to have just a city entity and then these other entities.
One block across Harlem and you're not in the city anymore. It's kind of
right.
nutty, yeah.
Right. So, but that entity now has been able to get corporate and philanthropic support, which our government entities could not, and has been what would you call it? Gathering resources in that way. But it's still a big challenge, because there aren't enough resources to deal with the magnitude of the problems that we have. And the young people who are out of school and out of work are basically our black and brown young people. And again, this is a way in which the broader pandemic racism in this country impacts ordinary people. It's harder for black and brown people to get work, especially since, they are disproportionately involved in the criminal justice system over what I used to call, and still call, petty antisocial behavior.
We could go on, but I mean, I think this is sort of a broad outline of all these depressing forces that seem to be pushing down on us from everywhere.
Well, I'm blessed to have a job that I really enjoy and where I think I can do a lot of good. And what's always attracted me to government is the opportunity to provide service to my constituents and to hopefully make substantive change. And one of the things we've worked on the healthcare side is trying to make our healthcare system sustainable. We've had a lot of help from the federal government through the Affordable Care Act on that. We'll see what challenges face us if the Affordable Care Act is modified in a significant way. And on the public safety side, we've worked with the stakeholders to try to reduce our jail population. As you point out, we don't arrest people, but after they're arrested, they come to us, to the jail. And we've done our best to reduce the number of people who are in the jail accused of nonviolent crimes, both because we think it's bad for them to be in the jail as they wait the disposition of their case, and it's bad for us as taxpayers to pay $162 a day to have them wait in jail if they're accused of shoplifting or low-level drug possession or not paying their child support or whatever. And we have seen, since we began to work on this very seriously in 2013, end of 2013, a 25% reduction in the jail population. So, and we think we can drive it down further by reducing the number of people accused of nonviolent crimes. We're not talking about people accused of murder or rape or robbery, but these other offenses that I referred to earlier. We can keep reducing it down to about 6,000. And the unintended consequence of that is that jail is a much more difficult place to work because the people who are there are accused of, a higher percentage of them are accused of more serious crimes, and more of them are actually serving a sentence than was the case before.
So it's becoming a tougher
environment in which to work.
Yeah.
But I think people need to understand the jail is for people accused of crimes, and prisons are where people are convicted of crimes serve their sentences. Jails are pretrial detention centers in this country. And only, even now as we've reduced the jail population and the percentage serving a sentence has gone up, it's only 14% of the people in the jail are serving a sentence. That means 86% are awaiting trial. And still, the majority of people who are awaiting trial are accused of nonviolent crimes, and we have to work on that. But we've made some progress. And so I guess what I'd say is, it is an extremely challenging environment because of what's going on in Washington and what's not happening in Springfield. But there's still a lot of good that we can do, and we're trying.
Very briefly, I know we're opening another sort of Pandora's box here, but Kwame Raoul's House Bill 1722, which is the idea that repeat gun offenders should have more lengthier sentences. I'm not sure where that is at right now in the legislature. It's kind of been rocky, but what's your feeling on it?
Well, Senator Raoul is my senator. I consider him a friend. He's been an ally on a number of our criminal justice reform efforts in Springfield. I disagree with him on this bill. The bill is about possession. And what's happened in Illinois is since 2000, so what's that, last 17 years, we've increased the penalties for possession 6 times. We have tripled the number of people that we had in 2000 in prison for gun possession. I don't see that that's had a big influence on the levels of violence in Chicago. I mean, what we need to do is focus on the shooters and the suppliers. This legislation is about possession. If the legislation was about penalties for shooters and penalties for suppliers, I'd be gung-ho in support of it. But I'm not in support of this legislation. And you have to understand, I mean, people buy guns in Indiana and adjacent states and come into our black and brown communities and sell them out of the trunks of their cars. We ought to be focusing on those people and putting them behind bars for as long as we can. They're doing a tremendous injustice to the communities where these young people who get possession of the guns live. We ought to come after them. We ought to come after the people who are shooters hard. But the simple gun possession, as I said, since 2000 we've increased penalties for gun possession 6 times. I don't see that we're at a place where there's less violence as a result of that. We got to focus on the people who are actually shooting and the people who are selling guns. And they rob the trains. I mean, we need to focus our efforts on where the guns are coming from and try to stop the flow of guns.
Why aren't we?
It hasn't been a priority. I'm grateful to Kim Fox. She's set up a unit to try to work on some of these issues, the supplier issues, the train robberies, and I'm grateful for that. And I think the police need to focus on it. I mean, the other thing is to come back to our point about police-community relations. The closure rate for murders in the city of Chicago is in the mid-20s. So basically 3/4 of the murders are unsolved.
And the closure rate for people who shoot somebody but don't kill them is in the single digits. It's maybe 5% or something.
Right. Nationally, the closure rate for murder cases is in the 60%, low to mid-60s. So we're doing half as well as the national average. And part of that is the police don't trust the community, and the community doesn't trust the police. And when you have bad relationships between the police and the community, nobody comes to talk to the police about what's happening. They don't trust the police to do anything about it, right? Or they think that the information that they share will somehow be divulged and it'll come back and hurt them. So when you don't have confidence between the police and the community, it's very hard to solve these crimes, whether it's the shootings, where it's less than, 10% of the shootings get solved, or the murders where it's 3/4 don't get solved.
Yeah.
I mean, that's a nightmare. We got to focus our resources on those who are involved in the violent crimes and accused of violent crimes and try to solve the violent crimes if we want to have community confidence.
Good place to end it. I have a few more other things, but we just ran out of time, so there you are. That's it. Maybe
Thanks for
another
inviting
time.
me, Ken.
I really appreciate you giving us an hour of your incredibly valuable time. It's very generous of you. Thank you. Toni Preckwinkle is the president of the Cook County Board, and it's always interesting and just, I don't know, it's just fun to talk to her. And we will be back next week with another program here on Chicago Newsroom. I'm Ken Davis, thanking you for watching too. And don't forget, you can watch us anytime by going to this address where you can see all of our programs, including this one. Watch it anytime you like. And don't forget SoundCloud and iTunes, because you can just listen to the show, go for a walk, throw in the earbuds. That's always something we encourage people to do too. All right? Be back next week with another show. Thank you very much for watching. Bye for now.